Hi, hello, welcome back. This is Dr. Ejas Pasha here. You've been watching many of the videos. Today is something related to information for the sake of patients. In particular, wherein the most common procedure is being the extraction of the tooth. Here, most of them go for the extraction of the tooth and land up in something called as dry socket. The reason being is the instruction is given post-operatively, that is after extraction or even after minor surgical procedures of intraoral or even post-operative implant procedures. So anything which is given incision in your mouth has to be followed for your better healing. The first thing is, do not take anything hot and spicy food for 3 to 5 days. Second, hot can be in the form of liquid, that is tea, coffee, milk, or in the form of any kind of food, whether it is vegetarian or non-vegetarian. Second, spicy. Spicy doesn't mean that it should be a black pepper or a chili powder. Any kind of spicy should be avoided. Post-operative, as I said, after extraction, after any implant placement, whether it is single implant or multiple implant. Third is any kind of intraoral or inside your mouth, the surgical procedures carried out. So this is very, very important. The second next point comes is about having an ice cream. How good is that? Is it compulsory? No, not necessary. What does the ice cream do? Because it's a cooling, it gives a cooling effect onto the injured area. So injured doesn't mean that patient has fallen or somebody has fallen. Injured means anything which is soft tissue, given incision, and you have removed your tooth or you have done some kind of a minor surgical procedures. So any kind of injury, one has to be it has to not necessary that you need to have an ice cream. You can just keep the ice cubes as much as possible. Keep it for about 20 to 30 minutes. May not be continuous. Here, particularly those who have a little brighter skin or the white skin, they should not do it completely or continuously. They should give about 2 minutes break and make it something like this. So you have something like cold water or ice cube pack, just hold it like this for a few minutes, say about 2-3 minutes, give a little break and place it again, give a little break. One thing. The second next comes is about having whether the person asks, can I have a bath or no? You can have a shoulder bath. Again, one has to be very clear and crisp and clear. I would say you should not take hot water baths, particularly anything hot inside your mouth. As I said in the first instruction, no hot and no spicy. Similarly, the next comes is when you go to bed, you should not sleep on the side which has been operated on. Say for example, your think that this tooth is removed or implant is placed or any minor surgical procedure has been done, you should not sleep on the particular side. If it is right side, you should avoid the right side. So is the vice versa. The next point comes is regarding your mobile. Can I use mobile? You are supposed to avoid again on that particular. So if you have your mobile and you've been operated on the left side, so avoid the left side. If you've been operated on the right side, please avoid the right side. I would always prefer and advise you to put it onto your volume. You can use your earphone or just avoid holding your phone onto the ears. So these are some of the instructions we have to strictly follow, and do not brush on that side. And if the sutures are placed, do not try to pull your sutures. Please take these instructions seriously. I hope those who smoke or drink, again, this is not to be advised. So no smoking, no drinking, and no strenuous exercises like going for gym or whatever you're running and track running or whatever you're trying to do, your exercises, please do avoid. So I hope these are the instructions you follow strictly and be happy. You will not get something called as dry socket. Its technical name is dolorosa sicca. Here again, treating dry socket would be a little difficult. Again, depends from person to person, patient to patient. It can be treated with lasers immediately as well. It can be treated with something called as zinc oxide eugenol, and your doctor, dental surgeon or dentist would be the best person to handle. So in any case of circumstances where you have a severe pain, it could be because of the suture is placed and you have somehow got your suture removed, or the suture is not placed, or your blood clot is dislodged either by your way of chewing, coughing or sneezing. So these are the things you got to take care. Thank you. See you in the next video.